Hey everyone, welcome back. We're doing a deep dive today into dry eye questionnaires.
Oh, yeah.
Which ones are good? Which ones are not so good?
Right.
We're going to be looking at a scoping review from the American Journal of Ophthalmology.
Okay, cool.
They're taking a close look at, what questionnaires are out there
hmm
and what are they being used for.
Yeah, there's so many out there. I think that's what's really interesting.
Yeah. So hopefully we'll get some clarity.
Yeah,
Kind of, help you figure out which questionnaires you might want to be using.
for sure, for sure.
So dry eye disease, or DED, is like super common,
Oh,
right?
yeah, absolutely. It's everywhere.
Like pretty much everyone's dealing with this.
It is, and this scoping review really highlights that.
Okay.
They point out that in adults, estimates for DED range from like 5%
Oh, wow.
to 50%,
50.
depending on what part of the world you're in.
Oh, wow. That's
That's a big range.
a huge range.
And a huge impact potentially on patients' lives.
Yeah, and no gold standard for diagnosis, really.
No, not really. It's kind of a combination of different things.
Right.
Clinical signs, what the patient tells you,
Yeah,
and then, of course, patient-reported outcomes.
right. Yeah, and that's where the questionnaires come in.
Yeah.
These PROs, or patient-reported outcomes, they give you that subjective information.
Yeah, like what the patient's really experiencing,
Right.
which, you can't always get just from looking at their eyes.
Yeah, yeah.
Yeah.
So this scoping review,
Mm-hmm.
they looked at all these different dry eye questionnaires.
Right.
How did they actually do this? Like, how did they go about it?
Well, they had a really systematic approach.
Okay.
So their main source was PubMed,
Okay.
and they looked at articles published in a bunch of different languages up to July 2018.
Okay.
English, French, Italian, and Spanish.
Okay, so pretty broad.
Yeah, they wanted to get like a wide view of what's out there.
Yeah, okay, so what did they actually find after
Oh,
all that searching?
they found 49 different dry eye questionnaires.
49. That's a lot.
I know, it's a lot to keep track of.
It really is a lot, and not all of them are good, right?
Well, that's the thing.
Or created equally.
Out of those 49,
Yeah.
only 22 had been validated.
Oh, so less than half.
Yeah, which is kind of alarming when you think about it.
That is alarming because if you're using a questionnaire that's not validated, then,
How do you know what you're really measuring?
yeah, what does it even mean?
Exactly, and that's why validation is so important. It's basically proving that the questionnaire actually measures what it's supposed to.
Okay.
And that it does it consistently,
Right.
reliably.
But so you're not just getting random data.
Exactly. You need to be able to trust the results.
So were there any that stood out from those 22 that were validated?
Well, one name that came up again and again was the Ocular Surface Disease Index,
Okay.
or OSDI.
OSDI, I've heard of that one.
Yeah, it's definitely a popular one.
Yeah.
It's been cited in over 620 studies, according to this review.
Wow.
So it's definitely widely used.
Okay, so super popular.
Mm-hmm. But, popular doesn't always mean best.
Right.
We'll get into that later.
Yeah, so tell me more about these different questionnaires. What kind of variety are we talking about?
Well, they vary in length, for one.
Okay.
Some are really short, like the subjective evaluation of symptom of dryness,
Okay.
which is just one question.
Oh, wow.
And then you have ones that are really long, like the impact of dry eye on everyday life questionnaire,
Okay.
which is 57 items.
57 items.
Yeah.
Wow, that's a commitment.
Yeah, so that's a big difference right there.
Yeah.
And then some questionnaires are designed for specific groups,
Okay.
like contact lens wearers
Yeah.
or people with Sjogren's syndrome.
Okay.
There are even some specifically for older adults, like the SEQ and the Shine.
So there's a lot to choose from.
There is.
So how do you know which one to use?
That's a great question, and it's something we're going to talk about in the next part of this deep dive.
Okay, we'll have to stay tuned for that then.
Yeah,
So we've got these 49 questionnaires, only 22 of which are validated.
and that's important.
Super important.
Yeah.
And they're all different lengths.
Yep, different populations they're designed for.
Mm-hmm. Different things they're focusing on.
Yeah.
But where are these questionnaires actually being used?
Well, geographically, the review found that validated questionnaires were being used a lot in Asia.
Which makes sense, right? Because
Yeah.
dry eye is very prevalent there.
Exactly. It seems like the areas with the highest prevalence of dry eye are also the areas that are using these questionnaires the most in research and in practice.
Yeah.
Yeah.
So besides Asia, were there any other trends in terms of who these questionnaires were being used on?
Yeah, they were used a lot in studies of adults,
Okay.
especially retired professionals and office workers.
Okay, so people who are probably looking at screens a lot.
Probably.
Yeah.
Which, can contribute to dry eye.
Makes sense.
Yeah, so
Hey.
it seems like prevalence and demographics are both playing a role in which questionnaires are being used.
Okay, so we know where they're being used and who they're being used on.
Mm-hmm.
But why are they being used?
Well, the most common reason was for diagnosis.
Okay, that's straightforward.
Yeah, but they were also used for figuring out who could be in research studies.
Oh, interesting.
Yeah, like inclusion and exclusion criteria.
So the result of a questionnaire could actually determine whether someone qualifies for a study or not.
Exactly, which again highlights why using a validated questionnaire is so important.
Yeah, you've got to have good data.
You do, especially when you're making decisions about people's health care or their participation in research.
Because it's not just about picking any old questionnaire. There's a lot more to it.
Definitely, and we're going to dive into those details in the next part of our deep dive.
Oh, good. You're looking forward to that.
Yeah.
Stay tuned.
We'll be right back.
Welcome back, everyone. So before the break, we were talking about how there's so many of these questionnaires out there.
It's a lot, right?
Yeah, 49 of them.
49, it's like, where do you even begin?
I know, but only 22 are actually validated.
Right, and that's really the most important thing.
Yeah, you really got to make sure you're using one that's actually measuring what it's supposed to.
Exactly. Validation is key. It's like the foundation of everything.
Okay, so let's say you've narrowed it down to those 22 validated questionnaires.
Okay.
How do you pick the right one for your practice?
Well, that's where you have to put on your detective hat.
Okay.
There are a few things to think about.
Like what?
Well, first, who are your patients?
Mm-hmm.
Are they mostly contact lens wearers?
Yep.
Are they older?
Mm-hmm.
Do they have specific conditions like Sjögren's syndrome?
Right, because some questionnaires are designed for those specific groups.
Exactly.
Yeah.
So you want to choose one that's going to give you the most relevant information for the patients you're seeing.
That makes sense.
And then think about why you're using the questionnaire.
Okay.
Are you trying to diagnose dry eye?
Mm-hmm.
Are you monitoring how well a treatment is working?
Right.
Or are you using it for research study?
Yeah, that would definitely influence which one you choose.
For sure. And then there are the more practical things to consider.
Like what?
Well, remember how some questionnaires have just one question
Yeah.
and others have over 50?
Yeah, like that when we talked about 57 items.
Exactly. So a longer questionnaire might give you more information,
Okay.
but are your patients actually going to fill it out?
Right. Especially if you're in a busy clinic.
Exactly. You got to think about what's realistic.
Yeah.
And don't forget about language.
Oh, right.
If you have patients who speak other languages,
Mm-hmm.
you need a validated translation.
It's like all these different factors you have to consider
Yeah, it's like putting together a puzzle.
to find the perfect questionnaire.
Right. And I think this review really shows how important it is for eye doctors to be thoughtful about the tools they're using.
Yeah, we can't just use whatever's popular, whatever we've always used.
We got to stay up to date and choose wisely.
So this scoping review,
Mm.
it wasn't just about making a list of all the questionnaires out there.
No, it was also about identifying areas where we need more research.
Oh, okay, like what?
Well, remember how we talked about how only 22 out of the 49 questionnaires were validated?
Yeah,
That's a big problem.
it is.
We need more research to validate the existing questionnaires
Yeah.
and to develop new ones that address specific needs.
So we need more and better tools, basically.
Exactly, and it's not just about validation.
Okay, what else?
We also need more research on how usable these questionnaires are.
Oh,
Like, are they easy for patients to understand?
yeah.
Can they actually fill them out without getting confused?
Mm-hmm.
Do they really capture what the patient is experiencing?
So we need to make sure they're actually working for both the clinician and the patient.
Right. This review is kind of like a roadmap for future research.
I like that, a roadmap.
Yeah, it shows us where we need to go from here.
Okay, so before we move on, I want to go back to something you mentioned earlier.
Okay.
You said that only 6 out of the 49 questionnaires had been translated and culturally adapted.
Right.
Why is that such a big deal?
Well, dry eye isn't the same for everyone. People experience it differently depending on their culture,
Okay.
their lifestyle,
Mm-hmm.
even the environment they live in.
So it's not one size fits all.
Exactly. And if we're using questionnaires that aren't sensitive to those differences,
Then we might miss something important.
right, or we might misinterpret what the patient is telling us.
So it's not just about translating the words, it's about making sure the questionnaire makes sense in different cultures
Exactly. It's about cultural relevance and appropriateness.
so that everyone can get a good dry eye assessment no matter what language they speak or where they come from.
Exactly. It's about equitable care.
This has been so helpful.
I'm glad.
We've talked about validation and choosing the right questionnaire and the need for more research.
And cultural sensitivity.
Yes. Anything else our listeners should keep in mind?
Well, that's a perfect segue to our final thoughts, which we'll get to in just a bit.
Welcome back, everyone. So we've been talking about these dry eye questionnaires.
Yeah, trying to make sense of them all.
And I think one thing that's important to remember is that they're just one piece of the puzzle.
Oh, absolutely. They're not the whole picture.
They give you that subjective information from the patient.
Right, like their perspective on what's going on.
But you can't rely on that alone.
No, you still need to do a thorough exam.
Right. You got to look at their eyes.
Yeah, get all the clinical findings.
It's like if you were trying to fix a car
Okay.
and you only listen to the engine noise.
I see what you mean.
You might get some clues.
Yeah.
But you wouldn't really know what was wrong until you looked under the hood.
That's a good analogy.
So these questionnaires, they're a good starting point.
Yeah, definitely.
But you need to combine that with everything else.
Exactly. Your clinical findings.
Yeah.
The patient's history. And your own expertise.
So it's really about integrating all of that information.
It is. You got to put it all together.
To figure out what's going on with the patient.
And then you can come up with a treatment plan that really makes sense for them.
Right. A personalized approach.
Yeah, exactly.
So it's not just about picking the best questionnaire. It's about using all the tools you have.
And using them wisely.
To provide the best possible care for your patients.
Couldn't have said it better myself.
So as you navigate this world of dry eye questionnaires, remember to stay informed.
Yeah, keep learning.
Keep asking questions.
Definitely.
And always put your patients first.
Absolutely. That's the most important thing.
And don't forget to listen to your patients.
Oh, yeah, for sure.
They're the ones who are experiencing this.
Their perspective is so valuable.
So really take the time to understand what they're going through.
It can make all the difference.
Well, I think we've covered a lot of ground today.
We have.
We've talked about validation and choosing the right questionnaire and the need for more research and cultural sensitivity.
That's a complex topic.
It is. But hopefully we've given our listeners some things to think about.
I hope so.
So as you go out there and use these questionnaires in your practice, remember to choose wisely.
Yeah. Do your research.
Stay curious and keep learning.
And keep those eyes peeled for new knowledge.
And on that note, we'll leave you with a question to ponder.
Okay.
What can you do today to improve how you use dry eye questionnaires in your practice?
That's a good one.
Let us know your thoughts.
Yeah, we'd love to hear from you.
Until next time, keep diving deep into the world of eye care.
Thanks for listening, everyone.